Hi, and welcome to the ANCODA Training Academy. Let's get started.
Good afternoon. I've been asked to show how ANCODA is used to do the state of California required COVID screening for employees. And actually what I'm showing here on the screen is a very nice flow chart that's been worked out by a home care agency in California to comply with the state rules. So basically walking through the flow chart is they have you dialing into a toll-free number and matching it up to that caregiver, and then it's asking the caregiver several questions, and based on their responses, it will either tell them they could go ahead off to work, or it'll let them know that that they have an issue and that they need to deal with that issue. And these are the questions that you'll see. So it's, within the last 10 days, have you been diagnosed or had a test? Do you live in the same household with somebody who's been diagnosed or is at risk? And then there's a long question about, in the last 24 hours, do you have any of these conditions that are not explained by a, kind of a pre-existing condition? And what I'm going to do to demonstrate this is I'm bringing my cell phone up on the screen here. I'm going to dial into a toll-free number and do it. And I'm just going to play the speakerphone so you hear what's going on. And this is how the solution works. So let's go ahead.
In the last 10 days, have you been tested or diagnosed with COVID-19? Press 1 for yes, press 2 for no. Do you live in the same home or do you have close contact with someone with diagnosed or suspected COVID-19? Press 1 for yes, press 2 for no. Have you had any of the following symptoms today or in the past 24 hours which are new and not related to a pre-existing condition? Fever, chills, repeated shaking or shivering, cough, sore throat, shortness of breath, difficulty breathing, feeling unusually weak or fatigued, loss of taste or smell, muscle pain, headache, runny or congested nose, diarrhea. Press 1 for yes, press 2 for no. Thank you for answering these screening questions. Please proceed to work as usual and have a great day.
All right, so as you see, in that case, I answered all the questions, negatively, meaning that I didn't have any of the warning signs for COVID. What I'm going to do in this next round is I'll answer that first question positively to show you how the solution goes from there. So we're ready to go again. Here we go.
Hello, thanks for calling. Please hold while we load your information. In the last 10 days, have you been tested or diagnosed with COVID-19? Press 1 for yes, press 2 for no. You may have COVID-19 and must be tested for the virus before returning to work. Without a test, you must remain at home for at least 10 calendar days. To return to work sooner and to protect those around you, contact your healthcare provider to be tested or check your city's guidance for COVID-19 testing locations and procedures. Contact your supervisor as soon as possible to confirm you understand this process, and then contact your supervisor again when you have test results.
All right, so that's what happens basically when somebody does answer any of the questions negatively. So just for completeness, if the questions or the responses need to be changed, it's all configurable in the system. But as you were probably able to tell, that was a live voice actress recorded the prompts, and so we could set up any protocol that you need, but there might be a little bit of work to get those recorded, and if you need them in multiple languages, that would take a little bit of extra time. And then I'm just going to show one screen in the system as well here. So this is an alert screen, and based on the calls that were made today, and they were actually made by a certain caregiver, we can kind of search and see what how the results are escalated here, and you could tell that we were testing with with two different caregivers, Tom Jones and Andrea Caregiver. And based on which question they answer, there's always going to be an alert to a supervisory person, saying which of the conditions, caused there to be an alert or an alarm. So that's going to be it, and we're going to end this video now. Have a great day.